Hey guys, this is student nurse Pia here. Welcome back to my channel. And in today's video, I'm gonna give you an SBAR, which stands for Situation, Background, Assessment, and Recommendation. On this will be focusing on a patient who is 32-year-old and she was currently admitted to the psychiatric unit due to acute exacerbation of schizoaffective disorder. So the patient was admitted following increasing concerns of auditory hallucination. She had disorganized behavior, mood instability, and poor self-care. So on presentation, she was observed responding to internal stimuli, talking to herself, and displaying periods of agitation and emotional lability. At present, the patient remains intimately responsive to hallucination, appears distracted during interaction, and demonstrates some sort of engagement during therapeutic communication. So the patient was documented with a history of schizoaffective disorder, and it was diagnosed early in adulthood with multiple previous psychiatric admissions. I think they mentioned it was 4. So related to medication non-adherence and relapse of schizoaffective disorder symptoms. So she has been prescribed antipsychotic medication along with mood stabilizers. However, adherence has been inconsistent, like I say, due to poor insight into her condition and reported side effects. There's also a history of substance abuse, which can also contribute to why her symptom, could relapse. And she lives sort of independently with limited social support and minimal engagement within community mental health services. Previous admissions show similar presentations, including hallucination, paranoia, mood fluctuations, and occasional verbal agitation, right? So upon assessment for my patient, which I can't tell you who, right? So the patient present with both positive and negative symptoms of schizoaffective disorder. So positive symptoms include auditory hallucinations, hearing things, paranoid delusions, thinking that people after her, disorganized thought process. You would see her rambling off, and she would just be talking about random stuff. And she responded to internal stimuli, and some negative symptoms like you would see during today when we had to go outside. She was sitting by herself, like everybody was playing games and all that, but she was there by herself. So social withdrawal. She don't appear to have any motivation for life. So mood appears between irritability, mild elevation, and periods of low mood. Judgment is impaired and insight remains poor. Sleep is disrupted. Patient mentioned that around 3 to 4 hours per night. From a safety perspective, there is no current suicidal or homicidal intent. However, due to active schizo and impaired judgment, the patient is considered moderate and requires ongoing observation. So, with the Erikson psychosocial theory link, okay, the patient falls within the Erikson stage of intimacy versus isolation, which typically occurs between age 18 and 40 years of age. This stage focuses on a developmental and close relationship, emotional connection, and social bonds. Failure to successfully achieve this stage can lead to social isolation and emotional withdrawal. So in this case, the patient demonstrates signs of isolation, including limited social support, withdrawal from interaction, and difficulty maintaining relationship due to psychiatric symptoms, right? So she struggles with trust. You could see that based on how she talks, and emotional regulation, right? And forming stable interpersonal relationship, interpersonal connections, which are essential components of this state. So it is recommended that the patient continues on close psychiatric observation with ongoing monitoring of mood, thought, content, and perceptual disturbances. So a psychiatric review is advised to evaluate medication effectiveness and consider the possibility of long-acting injectable antipsychotic medication to improve adherence. So the nursing care should include therapeutic communication, reality orientation techniques, structured daily activities to promote engagement, reduce environmental stimuli to prevent overstimulation. Because like I said, when I had conversations with her, you could tell that she can get overstimulated really quickly. So regular risk assessment should be continued each year. So a multidisciplinary approach involving psychiatric, psychological, and social work is recommended to support long-term stability. And that's all, folks, on today's episode of A Day in the Life of Psych Nurse. Ciao.